Here is your station.
Okay, I'm ready, ma'am.
All right, so if you have read and understood, considering it communication skills station, please begin.
Hello.
Hello?
It's Bashir, one of the surgical doctors working in HSO in the in the world. I'm calling for on-call register on-call consultant. Can I check who I'm talking with?
Yeah, I'm calling. I'm the on-call consultant, yes.
Thank you for taking my call, and I'm calling regarding the advice about patient post-operative axillary clearance and mastectomy. She developed axillary swelling, and her daughter want to take her home. And I need your advice for patient.
Okay. And has the patient made their own decision? Or has she
Okay.
been put into making decision to go home today by her daughter?
Okay, my patient is 68 years old lady. It's a known case of COPD with mild left ventricle failure, and also the patient underwent the mastectomy and axillary clearance for breast cancer, and 2 days ago was developed swelling, axillary swelling with her drain containing 4 and 10 ml of blood, red blood, and also experiencing COPD, experiencing shortness of breath. So her daughter wanted to take her home today, and I spent 20 minutes to convince her, but she didn't respond. And I talked with her to she is not good for patient to be discharged today. So I called you.
Yeah, I said you has the patient has made their own decision.
I think the patient, her daughter convinced the patient to come with her in her home, which 60 mile uh, 60 mile away from hospital, and also the patient has the would like to go their home when there is regain of full well to go home.
Okay. About the symptoms happen to this patient, what do you think?
I think the patient, in view of the drain containing 410 ml and swelling, probably develop refractory hemorrhage from the one side, and also experience of shortness of breath. There is also possibility of post-operative atelectasis and possibility of their exacerbating chronic obstructive pulmonary disease, and also the patient having cancer, active cancer, and surgery and immobilized. So I consider the axillary venous thrombosis and pulmonary embolism.
Okay. You said in this patient there is axillary swelling, right?
Yeah.
What do you think the cause of this axillary swelling?
Okay, it could be the hematoma from slip of clip, It could be lymphoma or lymphedema, or it could be there is the axillary venous thrombosis.
Why axillary venous thrombosis in this patient?
Because the patient has an active cancer, which is the great risk factor, and the patient is aged and immobilized post-operative. So it developed risk factor for axillary venous thrombosis.
Okay, and is this patient is stable?
Yes, patient is stable, but we still viewing of the COPD. We have to consider to exclude first the axillary venous thrombosis and the pulmonary embolism.
Okay, what the investigation you will request apart from the pulmonary embolism?
Okay, I will do full blood count to look for hemoglobin if there were any continuous bleeding, and also I will order arm duplex to look for axillary venous thrombosis.
I mean about the pulmonary embolism.
Yeah, I will do CT pulmonary angiography, and I will do chest X-ray and arterial blood gases, and I will do axillary Doppler arm, duplex of arm.
Okay, do you would like to do RFT or not?
Yes, I can do it because many factors like decreasing the hemorrhage can cause rising the RFT.
Okay, right. And what will be your plan of action in event of this complication?
It's according to the patient status for the hemorrhage. I will order a full blood count to look for is there bleeding or not. If there is bleeding, I will go first resuscitate the patient and go further according to hemoglobin if needed the blood transfusion or not. And then for pulmonary embolism and axillary venous thrombosis, I will check the CT pulmonary angiography and treat according to.
Okay, right. What do you do for the drain?
Okay, drain, I will leave the drain.
If they are insisting to go home.
Yeah, I will leave the drain in. Yes, I will leave the drain in if they resisted, and I will inform the patient how to deal with the drain, and I'll involve the community nurse also. And if there is coming less, drain less, to go to neighbor clinic to remove the drain.
Okay, right. So what will you do if they were insisting to go home?
Yeah, I will inform the patient about the complication that might occur if they from this premature discharge, and I inform also the mother, the patient and her daughter about the complication, and I will inform the patient about there is the legal documents to sign that is stated in. This is she wants to discharge again the medical advice, so she take all the responsibility, and she knows about all possible complication that might occur, and I also inform the patient about the warning sign and how to deal with it, and go to the neighbor.
Thank you.
Thank you.
Please keep me updated. Thank you.
Okay, thank you.